At the top of the screen, you can see the characteristics of good feedback. Feedback should be direct, specific, immediate, frequent, practical, honest, and respectful. These words will stay at the top for you to keep in mind when you come up with feedback for the scenario. Here's a scenario for you to think about. You have an intern named Gwen. What feedback would you give to Gwen in this situation? You ask Gwen to review the patient chart and pull assessment data before you go see the patient together. When you review the chart, you notice that the patient has a history of chronic kidney disease and has an elevated creatinine and lower GFR. Their potassium and phosphate are also high. When Gwen is done independently collecting the data, she reports to you about the history of chronic kidney disease, but she doesn't say anything about the labs. You ask Gwen to make the connection. Did you look at their labs? How do these results relate to what is happening medically? Gwen says, I saw there were some abnormalities, but I didn't really know how it was related, so I didn't write it down. What feedback would you give to Gwen? I recommend that you pause the video now and write down how you might phrase feedback. Unpause this video when you are ready to see an example of good feedback. There are lots of different approaches or ways of phrasing the same message. Keep in mind that there are lots of helpful ways of giving feedback in this situation. One potential way of giving feedback to Gwen is to say, the lab results help tell us what's happening clinically for this patient, and so it is important that you work to understand them. When you are uncertain of a lab value or how it is related to the case, you can look it up or ask me. Can you please take 5 minutes to look up some of the lab values that were abnormal for this patient? After you do that, we can talk about it together and make the connections to their medical history and the overall clinical picture. This feedback is direct and immediate. It is also specific and practical because it narrows in on the lab values that were abnormal in this particular instance and gives Gwen an action item, which is to spend 5 minutes looking things up before having a discussion. This feedback is honest because it points out what Gwen missed, which is something she needed to know. It is respectful because it doesn't criticize Gwen, but acknowledges that what was missed is important. The tone of delivery will also make a big difference in this being respectful. We will look at one more example in this video. Gwen does a diet education for a patient on a minced diet and no mixed consistencies. She does a great job explaining the minced diet, what foods are appropriate or not, and how foods can be prepared to this texture. She struggles to explain the no mixed consistency guideline to the patient. She stumbled over some parts of the recommendation. She looks to you when the patient has questions, so you jump in and answer them. After the session, you and Gwen return to your office. What would you say to Gwen when you get back to the office? Please pause this video and write down how you would give feedback to Gwen in this instance. Unpause this video when you're ready to see an example. There isn't one correct way to give feedback, but here are some things you might want to do. Firstly, you may want to ask Gwen if you can offer her feedback. This puts her in the mind space for it, and it helps build a trusting relationship. When she says yes, you could start with offering positive feedback. You might say something like, "You did a great job explaining the minced diet texture. I really liked the way you explained the way some foods could be prepared." After that, you can bring up the specific and practical components of feedback by saying something like, "I noticed you stumbled on some parts of the no mixed consistency recommendations and looked to me to answer the patient's questions. I think it may be helpful if you review the no mixed consistency guideline. You can write down some phrases that you would use in another session like this, so that you're more prepared for next time." This feedback is direct because you've asked Gwen if we can give her feedback, and you are speaking to her. This feedback is specific because the exact behavior you observed is described. This feedback is immediate because this conversation is happening as soon as we've returned to the office after speaking to the patient. This feedback is practical because you've provided Gwen with an action item of what she can do to improve. You've given her a task to work on. This feedback is honest because you've discussed both the positive action and the challenge Gwen experienced. This feedback is respectful because you're giving this feedback in the privacy of your office and are focused on your observations. The feedback is about the activity and not about Gwen herself. Another method of feedback can include prompting to get the intern to reflect and create the practical solution that will work for them. This is generally a tactic better used later in a rotation, when the intern is at an advanced beginner level in a specific skill, or even when they are competent and looking for continuous improvement. You might say something like, "I noticed you had a harder time with the no mix consistencies part of the session. What do you think happened that made that section more difficult for you?" This feedback method is still direct and points to a specific action or behavior, but it leaves the practical piece for the intern to come up with. That's it for this video. I hope you'll join us for another Preceptor Skill Snack soon.